A woman can actually get pregnant at any point during her menstrual cycle. It is a myth that you cannot get pregnant while you're on your period. Sperm can actually survive in the uterus for about 7 days. So if you are trying to prevent a pregnancy, making sure you're not having intercourse during your period is not a viable way to do that.
Welcome to VNA Today. I am your host, David Miranda. Mammograms are an important medical test that women should schedule regularly because they're the best way to catch early signs of breast cancer. October is Breast Cancer Awareness Month, and VNA Health Care's Jessica Baeza is teaching us all about mammograms.
A mammogram is the X-ray of the breast used to look for early signs of breast cancer. Currently, a screening mammogram is the best resource, the best test to screen for early signs of breast cancer. During a mammogram, your breast will be firmly pressed between two plastic plates. We just do it to tautness, so we don't do it more than we need to, but little compression is necessary. That helps with overlapping tissue. It helps spread that out and get some more effective photo. They're commonly described as very uncomfortable. Each person's a little different, but the benefits of early detection far outweighs the brief discomfort. A lot of times we want to catch it before a lump is even felt. Self-exams are very important, but mammograms can catch things much, much earlier, which can result in less invasive surgical procedures and easier treatments. We want to catch that as soon as possible. They should start getting them at age 40. Early detection is critical. They should get them annually and as long as they're in good health. The first step would be to schedule your mammogram after your menstrual cycle. It's not smart to schedule it a week before or during your period. Your breast may be a little swollen and tender. It's also important to avoid wearing lotions, deodorants, perfumes that could affect the accuracy of your results. Another thing that people tend to forget is try not to wear a dress on the day of your exam unless you're comfortable pulling it down. Sometimes they're elastic enough to pull down. We just have you undressed waist up off. We have a little gown that opens in the front. So you want to typically have something to cover your waist down. So unfortunately, you won't get your results that day if it's a routine screening, but you will get it in a few weeks. You'll get a results letter. Your ordering physician will also get the detailed report. If your mammogram comes back normal, continue getting your mammograms annually. It's also beneficial if the radiologist is able to compare any prior mammograms. So if they were from an outside facility, I recommend getting them, or let us know where they were and we can request those for you. So if your results come back abnormal, that does not mean we found something. Try your best not to panic. What that does mean is we're going to take additional photos. Your doctor might order additional tests such as ultrasound. You'll be back for more imaging. You'll get results that day. They may refer you to a breast specialist or surgeon who can better assess that tissue. The VNA offers pre-cancer screenings as well as wellness exams to ensure that everyone has access to safe and reliable breast cancer testing.
Thank you so much, Jessica. To schedule an appointment or learn more about the services offered by VNA Health Care, call us at 630-884-4566 or visit us online at vnahealth.com. I'm your host, David Miranda, and see you next week.